Boy enters the dental office. Hi, I'd like to schedule a routine checkup. It's been a while since my last visit. Receptionist. Hello, I'd be happy to help you with that. Can I have your name, please? Boy. Sure, it's James Carter. Receptionist. Thank you, James. Let me check our schedule for available slots. Checks the system. It looks like we have an opening on Tuesday at 3 p.m. or Thursday at 10:30 a.m. Which one works better for you? Boy. Thursday at 10:30 a.m. works for me. Receptionist. Great. I've scheduled you for Thursday at 10:30 a.m. Can you please confirm your phone number and email address, just to make sure we have the correct details? Boy. Sure. My phone number is 555-1234, and my email is james.carter@email.com. Receptionist. Thank you, James. Your appointment is now confirmed for Thursday at 10:30 a.m. Boy. I haven't been to the dentist in a while, so I'm not sure what to expect during the checkup. Could you tell me a bit about it? Receptionist. Of course. During a routine checkup, the dentist or hygienist will clean your teeth first. This includes removing any plaque or tartar buildup. After that, the dentist will inspect your teeth and gums to make sure everything looks healthy. If needed, they may take x-rays to check for any hidden issues. Boy. Sounds good. How long does it usually take? Receptionist. The whole appointment usually lasts about 45 minutes to an hour, depending on how much cleaning is needed. It's pretty quick. Boy. Okay, that works for me. Boy. How often should I come in for a checkup? Is once a year enough? Receptionist. It's recommended to visit the dentist every 6 months for a routine checkup. This helps catch any problems early and keeps your teeth in good shape. Even if you don't have any issues, regular visits are important for preventive care. Boy. Got it. I'll make sure to come in every 6 months from now on. Boy. Are there any new recommendations for improving oral hygiene? I try to brush twice a day, but I feel like I could be doing more. Receptionist. That's a great start. In addition to brushing twice a day, you should also floss daily to remove food particles and plaque between your teeth. Using mouthwash can help kill bacteria and freshen your breath. You might also want to use a soft bristled toothbrush and avoid brushing too hard, as that can damage your gums. Boy. I've heard a lot about electric toothbrushes. Do you recommend using one? Receptionist. Yes, electric toothbrushes can be more effective at cleaning your teeth, especially for people who struggle with brushing properly. They help remove plaque better than manual toothbrushes and can be gentler on your gums. But it's still important to use the right technique and brush for at least 2 minutes. Boy. I see. I'll think about switching to an electric toothbrush. Boy. Is there anything else I should be doing to keep my teeth healthy? Receptionist. Make sure you're using fluoride toothpaste, as it helps strengthen your teeth and prevents cavities. Avoid sugary foods and drinks, as they can lead to cavities and gum disease. And don't forget to drink plenty of water throughout the day to keep your mouth hydrated. Boy. Okay, I'll pay more attention to that. Boy. Are there any common mistakes people make in their oral care routine? Receptionist. One common mistake is brushing too hard, which can cause gum recession. Another is not flossing regularly. Plaque can build up between your teeth and lead to cavities or gum disease. Also, some people forget to replace their toothbrush every 3 to 4 months, or when the bristles become worn out, which reduces the toothbrush's effectiveness. Boy. I didn't know that about brushing too hard. I'll be more gentle next time. Receptionist. I'm glad I could help. Just a reminder, please arrive a little earlier than your scheduled appointment time to fill out any necessary paperwork. Boy. Thanks. I'll be there on Thursday at 10:30 a.m. Receptionist. Perfect. We'll see you then. Have a great day. Boy, thanks, you too. Leaves the office. Hygienist. Greet the boy. Hi there, James. Welcome back. How are you today? Boy. Hi, I'm doing well, thanks. It's good to be back. Hygienist. Great to hear. So have you had any concerns with your teeth lately? Any pain or sensitivity? Boy. Well, I haven't had any major issues, but I've been feeling a little sensitivity in one of my teeth. It's not too bad, but it's been there for a while. Hygienist. Okay, that's good to know. Let's start with the routine checkup, and we'll take a closer look at that tooth. Please take a seat in the dental chair, and we'll get started. Boy. He sits in the chair. All right, here we go. Dentist. Enters the room and greets the boy. Hello, James. I'm Dr. Smith. How are you today? Boy. Hi, Dr. Smith. I'm doing good. A little nervous, but that's normal, I guess. Dentist. I totally understand. Don't worry, we'll make sure everything goes smoothly. Let's take a look at your dental history first. When was your last checkup? Boy. It's been about a year since my last visit. Dentist. Okay, that's a good time to get a checkup. Have you noticed any changes in your oral health over the past year? Other than the sensitivity you mentioned? Boy. No, not really. Just that sensitivity in one tooth. I was wondering if it's something I should worry about. Dentist. Let's take a look at that. I'm going to inspect your teeth now. Looks at the boy's teeth carefully. I see a little wear on that tooth. It might be the result of grinding your teeth, or it could be due to some gum recession. Boy. Oh, that's good to know. Should I be concerned about it? Dentist. It's nothing too serious right now, but we'll keep an eye on it. It's a good idea to address it early before it becomes a bigger problem. Boy. Thanks for the info. So I've been trying to take good care of my teeth, but I've heard a lot about electric toothbrushes lately. Do you think they're worth using? Dentist. Electric toothbrushes can be very effective. They make brushing easier and can clean your teeth more thoroughly than a manual brush, especially if you have a hard time brushing well or for long enough. Just make sure you're using it with the right technique. Boy. That sounds helpful. What about teeth whitening products? I've been curious if they work and if they're safe to use. Dentist. Teeth whitening products can be effective, but they should be used with caution. Overuse of whitening products can sometimes lead to tooth sensitivity or damage to the enamel. It's best to use them in moderation, and I would recommend talking to your dentist before using any whitening kits. Boy. Got it. I'll be more careful with that. Thanks for the advice. Dentist. Now about that sensitivity you mentioned earlier, there are a few things we can do to help with that. One option is using desensitizing toothpaste, which helps reduce sensitivity over time. Another option is applying a dental sealant to that tooth, which can protect it from further damage. Boy. I've heard of desensitizing toothpaste. Is it really effective? Dentist. Yes, it works well for many people. It's worth giving it a try. The toothpaste contains ingredients that block the nerves in your teeth, helping reduce the pain or sensitivity you're feeling. Boy. That sounds like something I should try. What about the dental sealant? How does that work? Dentist. A dental sealant is a thin coating that's applied to the chewing surface of your teeth. It acts as a protective barrier against decay and wear. It's usually used on molars, but we can discuss whether it would be helpful for the sensitive tooth as well. Boy. I think I'll try the desensitizing toothpaste first and see how it goes. But what can I do to prevent other problems in the future? Dentist. Great question. A preventive measure you could consider is fluoride treatments. Fluoride helps strengthen your teeth and makes them more resistant to cavities. I also recommend maintaining a balanced diet, rich in calcium and vitamin D, to keep your teeth strong. Boy, that sounds simple enough. I'll definitely make sure I'm getting enough of those nutrients. Is there anything else I should be doing? Dentist. Just make sure to brush twice a day, floss daily, and avoid sugary foods and drinks. And remember, regular checkups every 6 months will help keep everything in check. Boy, thanks, Dr. Smith. I feel better knowing that it's nothing too serious. I'll make sure to follow all your advice. Dentist. You're welcome. I'm glad we could address your concerns. I'll see you in 6 months for your next routine checkup. We'll schedule that now. Receptionist. Enters the room. Hello again, James. Let's get your next appointment scheduled. How does next June 10th at 10:30 a.m. sound? Boy, that works for me. I'll be back then. Receptionist. Perfect. Your follow-up appointment is confirmed. Thanks for coming in today, and take care of your teeth until then. Boy. Thanks, Dr. Smith, and thank you too. I appreciate all the help and advice. See you next time. Dentist. Take care, James. Have a great day. Boy. You too. Leaves the office. Write a sentence in English in the comments section below. Find the mistake. Incorrect. I'm not sure if this is safe using whitening products. Correct. I'm not sure if it's safe to use whitening products. Explanation. The sentence should use to use instead of using to properly indicate the action of whitening products. Incorrect. I have been tried an electric toothbrush. Correct. I have tried an electric toothbrush. Explanation. Been is unnecessary here. The correct form is I have tried to express past experience. 5 vocabulary words. Sensitivity. A feeling of discomfort or pain in a part of your body, especially teeth, when exposed to certain things like cold or sweet foods. Desensitizing. A process of reducing sensitivity or pain, often using special products like toothpaste. Sealant. A protective coating applied to teeth to prevent cavities or further damage. Fluoride. A substance that helps make teeth stronger and protects them from decay. Cavities. Holes or damage in teeth caused by decay. If you want to learn how to talk to a doctor in English and feel confident during your visit, click the video here or follow the link in the description.